I want to thank you for joining us in the 11 Breaking News Center this afternoon. I'm Lauren Watson, your digital anchor here at KKTV 11 News, and I'm here today with Steve Carleton. He's the Chief Clinical Officer at Porch Health and Front Range Clinic. Now, Steve, it's Women's History Month, and we wanted to talk a little bit about an issue that impacts women today when it comes to addiction and substance use disorder, and that's pregnancy. So I guess my first question for you is, how important is it to treat a woman for substance use disorder when they're pregnant?
Very important, to put it lightly. What we know from research and recent history, from 2018 to 2021, the rate of overdose in pregnant women shot up more than 3 times. Right, so it's becoming more of a problem with fentanyl out there on the market. We know that pregnant women are struggling to come into treatment at much higher rates and paying really high costs.
And is treating a pregnant patient much different from treating any other patient for this type of disorder?
It's not. It's not all that different. You do need to pay attention to women's needs in pregnancy, right? And sort of what types of vitamins are they on? Are they receiving help and care while they're pregnant? The biggest barrier is the fear around coming in and asking for help. And one of the most important things to put out there for viewers is that in Colorado in particular, when women come in for care, that is not something that triggers a child protection report. So women can come into care in Colorado without fear that they're going to be reported to authorities and get in some type of trouble for it. And so I think that's more, it's the care is not all that different, but the reasons people resist coming in is different, unfortunately.
Now, when it comes to timeline on treatment for pregnant patients, is it better to treat someone as early as possible? Should they wait until they're a little further along in their pregnancy? What should that timeline look like for someone seeking help?
Immediately seeking care is the best option, right? And I think people should know they're not going to be judged for it, right? Substance use is a really common problem. 10% of the population struggles with some type of substance use disorder. So people need to understand you're not alone in this. And coming in and figuring out what type of care is most appropriate for you as soon as possible is the best plan. For opioids or painkillers, fentanyl, people that are addicted to these types of substances, what we know is medications like Suboxone are the best option for people, right? It is a partial opiate, but what we know about overdose rates is if pregnant women are on Suboxone, you should stay on Suboxone, and if you aren't on Suboxone, it's a really good thing to consider for the health of yourself and for the health of your baby.
And I guess that kind of gets into my next question. What does a treatment program typically look like, depending, I guess, on the substance that someone is dealing with or struggling with?
You know, with alcohol, we have medications like naltrexone and other medications that can help with withdrawal management and things like this. And with opiates, painkillers, fentanyl, these types of things, it's medications like naltrexone or the injectable version called Vivitrol or Suboxone, or the injectable versions of Suboxone. Those are the best resources you can get when you're pregnant. The other most important thing to consider if you're struggling with a substance use disorder, outcomes are best for people that get help, right? If you're struggling with a substance use disorder, you're going to get a lot further engaging in therapy, engaging in supportive groups, engaging with professionals that can help you come up with coping skills and relapse prevention tools. Coming in and doing the work and getting engaged and help makes all the difference. And that really, at the end of the day, is what separates people that are sort of successful in recovery from people that aren't.
And when it comes to these types of programs, how important is aftercare?
Aftercare is critical. Again, to my previous point, the longer you're in care, the higher the chances are of success. Like if you were going to Las Vegas and going to sort of gamble, right? The best bet is on people that initiate care early and stick with it. The more groups, the more therapy, the more doctor's appointments you attend, the higher likelihood of success, the better that gamble is going to be.
Awesome. Well, Steve, those are all of the prepared questions that I had for you today. Is there anything else you wanted to add while we're talking about this topic?
I think in Colorado at Front Range Clinic, Porch Health, we're the best place to initiate care, and we are really easily accessible, and we take a harm reduction approach. We really try and work our best to reduce stigma and judgment and all those things that lead people to not get care, and we're all across Colorado, and 866-MATSTAT is the best way to get a hold of us. And yeah, I would just remind people out there that if you're struggling, it's a good time to access care, and I think people will be surprised at how good their experience can be if you just go out, seek help, and start working on it.
Well, Steve, thank you so much for taking the time out of your day to chat with me about this very important topic.
My pleasure, Lauren. Thank you.